In this video, we will explore familial hypercholesterolemia, FH. This genetic disorder affects cholesterol metabolism, leading to increased cardiovascular risks. We will discuss its pathophysiology, clinical presentation, diagnosis, management, and future research. Let's dive into the intriguing world of FH. Familial hypercholesterolemia is a genetic disorder causing high LDL cholesterol and early cardiovascular disease. Mutations in LDL receptor gene inhibit LDL clearance, leading to cholesterol buildup in the bloodstream. LDL receptor mutations play a crucial role in the pathogenesis of FH. These mutations can lead to impaired receptor synthesis, altered receptor structure, or defective receptor recycling back to the cell surface. Impaired receptor recycling results in reduced LDL uptake by cells, leading to increased levels of circulating LDL cholesterol. The severity of FH is often correlated with the nature and number of mutations in the LDLR gene. Apart from LDL receptor mutations, defects in apolipoprotein B100, APOB100, can also contribute to FH. APOB100 is an essential component of LDL particles and facilitates their binding to the LDL receptor. Mutations in the APOB100 gene can disrupt LDL receptor recognition and impair LDL clearance, leading to familial hypercholesterolemia. Understanding the molecular basis of these defects is crucial for the accurate diagnosis and management of FH patients. Heterozygous FH is the most common type of FH. It is inherited from one parent and characterized by high LDL cholesterol levels, a family history of premature heart disease, and increased risk of developing cardiovascular disease. Diagnosis involves LDL cholesterol levels, tendon xanthomas, family history, and genetic testing. Homozygous FH is a rare and severe form of FH caused by mutations in genes related to LDL metabolism. It leads to high LDL cholesterol from birth and increased cardiovascular disease risk. Clinical presentation varies, but aggressive cholesterol-lowering therapies are needed for management. Cascade screening plays a vital role in the detection and early diagnosis of FH. It involves systematically screening family members of an index case with FH to identify individuals at risk. Cascade screening aims to identify affected individuals, initiate early interventions, and identify other family members who might benefit from genetic testing and tailored management strategies. Genetic testing plays a crucial role in confirming the diagnosis of FH and identifying specific genetic mutations, enabling precise risk assessment and targeted therapies. LDL apheresis is a therapeutic procedure used in severe cases of FH to reduce LDL cholesterol levels. It involves the extracorporeal removal of LDL cholesterol from the bloodstream using specialized equipment. LDL apheresis is effective in rapidly lowering LDL cholesterol levels, and it has been shown to reduce the risk of cardiovascular events and improve overall outcomes in patients with FH. However, it is an invasive and expensive procedure that requires specialized centers and trained personnel. In recent years, significant advances have been made in pharmacotherapy for FH with the introduction of PCSK9 inhibitors. PCSK9 is a protein that promotes the degradation of LDL receptors, thereby reducing their recycling to the cell surface. PCSK9 inhibitors block this pathway, resulting in increased LDL receptor expression and enhanced LDL clearance. These novel pharmacotherapies have shown promising results in lowering LDL cholesterol levels, reducing cardiovascular events, and providing additional treatment options for patients with FH. FH can present unique challenges and management considerations in special populations such as children and pregnant women. Early diagnosis, risk assessment, and aggressive treatment strategies are crucial in pediatric FH to prevent the early onset of cardiovascular disease. Pregnancy-related FH management requires careful consideration of treatment options that balance the need for lipid control with the safety of the fetus and mother. Individualized approaches are essential in these populations to optimize outcomes while ensuring the well-being of the patient. FH is strongly associated with an increased risk of atherosclerotic cardiovascular disease, ASCADE. Elevated LDL cholesterol levels, especially in the presence of genetic mutations, contribute to the accelerated development of atherosclerosis. Individuals with FH have a higher incidence of coronary artery disease, myocardial infarction, stroke, and peripheral arterial disease. Comprehensive management strategies aimed at LDL cholesterol reduction, blood pressure control, lifestyle modifications, and other preventive measures are important in reducing the burden of ASCADE in these patients. Genetic counseling plays a crucial role in the management of FH patients and their families. It involves providing accurate information about FH, its inheritance pattern, and the associated cardiovascular risks. Genetic counselors help patients and their families understand the implications of genetic testing results, interpret the significance of identified mutations, and make informed decisions regarding family planning, cascade screening, and preventive strategies. Patient education is also vital in FH management, focusing on lifestyle modifications, adherence to treatment regimens, and regular cardiovascular screening. Ongoing research efforts continue to unravel the complex mechanisms underlying FH, aiming to improve diagnosis, management, and outcomes. Novel approaches include exploring the role of non-coding DNA segments, better understanding the genetic basis of disease severity, identifying new therapeutic targets, and developing innovative treatment modalities. Furthermore, advancements in technology and the integration of big data analytics hold promise in unraveling additional genetic and environmental factors contributing to FH and its associated cardiovascular risks. In conclusion, a thorough understanding of familial hypercholesterolemia, including its mechanisms, symptoms, diagnosis, treatment, and research, is vital for healthcare professionals to effectively manage this condition and reduce its impact on individuals and global health.